Cfbhn is a not-for-profit 501c3 corporation contracting with community service organizations to provide a full array of publicly funded mental health and substance abuse services in 14 Suncoast counties. Services include acute care, residential treatment, housing, medical, outpatient, recovery support, and prevention. Learn about everything Cfbhn has to offer today on Bayside. Good morning and welcome to Bayside. I'm your host, Shelly Sanders. I know I was saying earlier that we are talking all about Cfbhn, which is Central Florida Behavioral Health Network. And I know I told you we'll tell you everything there is to know about it, but as I just told Doris, there's no way we could do that. Welcome back to the show, Doris Nardelli.
Thank you.
It's always a pleasure to have you here, and I'm constantly amazed at how much you all do in 14 counties in our state. You are a very huge part of making a lot of things happen in these 14 counties. So that said, you'll have to come back, which you do frequently, and we appreciate that. So let's get down to it. For those individuals that maybe are new to the area or have never heard of you before, maybe even utilize some of the services that you were responsible for, but they don't even realize that it's you that have actually put this together. Talk about Cfbhn, when I say managing entity, how are you threading these 14 counties together, and what exactly does that mean?
Yes, managing entities were put together by the Florida legislature, and it was an effort to make the services closer to the communities that were served. So our 14 counties is in our network that we oversee and manage, and we've been doing that for over 25 years now. And there are 7 managing entities total in the state of Florida, and we have an association that we belong to, so we can oversee what's going on throughout the entire state and make that comprehensive, and that so we're hitting all of the major aspects that we need to. But we are and can focus on our 14 counties and specifically what those counties need and what they tell us they need. We do a triennial needs assessment that looks at what those counties have experienced, what their constituents, their citizens have experienced, and what they would like to see more of or less of. And then we act on that needs assessment and build that into our plan of how we develop this system of care throughout those 14 counties.
Which I would imagine that every county is unique in their own needs. I would think that, say, Polk County is very different from, say, Hillsborough, or Pasco being very different from Hillsborough or even Pinellas County.
Yes, we have the major metro areas, which is the Hillsborough County, Pinellas County, and then we have our little very rural areas like down south where you have Henry, Glades counties, where there are fewer people but still needs, and you have to figure out how do you meet those needs in those very small counties that are sort of special and unique in what they want, how they want to receive services.
Right. So going back to basically what you are, behavioral health network. So correct. A network of people is what's coming into play here. Talk about that behavioral health aspect of it. What exactly
behavioral health is what it indicates is we are talking about mental health and substance misuse or abuse, those sort of needs that people have, from crisis care all the way to outpatient, even prevention services, and a whole range of other subjects that don't necessarily fall under strictly a medical model, but housing, for instance, or what you're doing if you are touch another system such as child welfare, because we work collaboratively with a lot of partners. The forensics side of the work we do works with the court systems and folks that end up over in that system because they've been arrested. Usually because something has happened and they've gotten themselves in a little bit of a problem because of substance misuse, abuse, or mental health issues that are untreated. So we work very closely with those systems as well to get people help they need while they're also being served in those other systems.
I love how you said that, because it does all kind of come in, it's all braided together, if you
Correct.
will. You've got prevention can stop something from becoming a crisis, for example.
Correct.
Right?
Yeah.
So let's talk about the recovery movement, which would be post-crisis, post-prevention. Now let's talk about recovery. Tell me about this recovery movement.
We do have a new focus moving forward, where we have contracted with recovery organization systems within the community, and these groups are run by people that previously had experienced substance misuse or mental health issues, and they are in recovery. So they are the perfect people to help folks that are just starting their journey into recovery, and they have formed these organizations, and we're contracting with them, and they're coming alongside these folks and are offering services and direction and connections that may be more timely for the person that is seeking services than perhaps the traditional services, because these folks know exactly where folks have been and what they really kind of need, and they can talk the talk with them.
Which at the end of the day, for someone to try and help, and if you're on the receiving side of that, needing it, it can kind of sometimes, I would imagine, feel like you're on an island, like, what do you really know about what I'm going through, unless you're a person that has been there.
And there is something called stages of change, and that's where a person kind of says, oh yeah, I think I have a problem, but I'm not sure I'm ready to deal with it yet,
Right.
but I'm thinking about it. And then they move on into, well, now I'm actively ready to do something about it. Well, the people in recovery, they know all of these stages of change because they've been through them, and so they can kind of help people when they sort of regress back and they're not moving forward, and they have a little bit of a relapse, because they know what it's like and they know how to address it. So it's very helpful for a person to continually move forward with the help that can be provided.
Now, Doris, how do you access the care for example, the care that we're talking about now, right? As it relates to recovery, say we've got someone new to the area, maybe they are or are not part of a program like an NA or an AA, but they just don't know what to do. And they're hearing this for the first time. How do they access services like this?
Well, the one thing you can do is you can call our phone number, and we have people that are there, and they can connect you with what is the closest service in your area based on what your needs are. We do have a locator feature on our website where you can plug in your address, and it will pop up and populate and say, these are the people that you can go see that provide those kind of services. You kind of select, are you an adult or a child? Do you want mental health? Do you want substance or substance misuse, or do you want housing? And then it pops up and it gives you some options. You can go, if you like to be on the website, you can go there and look at their website.
As a matter of fact, speaking of, we are looking at your website right now. So for you at home, if you are interested, or perhaps you're intrigued by what all the services, because we have just only barely scratched the surface of what all they provide here in the area, I would encourage you to please log on to this website at cfbhn.org, cfbhn.org, and you can see what Doris was just talking about and trying to find the location of services that you need. And maybe you're just curious, so I would encourage you to check it out while we go to break. But don't go anywhere, because we're coming back. We got a lot to talk about. Welcome back to Bayside. I'm your host, Shelley Sanders. I've been talking with Miss Doris Nardelli. She is with CFBHN, that's Central Florida Behavioral Health Network. honestly, we'd never get to everything that you guys do over there in one episode,
No.
quite even possibly not even 10 episodes. So with that being said, let's get down to it. I know you guys work closely, you even mentioned it, that you work closely with the child welfare system. You also work with 2 school systems with our 2 counties, the school systems within those counties, Hillsborough and Pasco, and I would imagine both of those kind of work hand in hand in some cases. So talk to me a little bit about what you do over there in Pasco and Hillsborough counties in those school systems, and then furthermore into the child welfare system and how that's affected.
Well, you remember several years ago with the Marjorie Douglas Stoneman shooting down in Miami, where there were several, children at school were shot. And after that occurred, the legislature appropriated funds to each of the counties in Florida. And Hillsborough County and Pasco County decided to expend their funds in collaboration with us to develop a system that took the burden off of the school system to get youth and their families into care if they need it. So if there's referrals are made, they come in through this program, they're assessed and they're referred out to community providers. Some are the community providers that existed in our network. Some are new ones that we added because we needed extra to service those children and families that were in need in the school systems in both areas, both Pasco and Hillsborough. So then there is follow-up with the school system that those families and children have gone and received services, and that information goes back to the school so they can make that part of the plan that they have for the youth to help with their education, because the schools are primarily charged with educating children. They are not supposed to be behavioral health specialists, and they don't really want to be. They really want their teachers to teach and their administrators to do what they need to do to keep the school running. So we are a close partner with them and have developed this program that places staff on site at their locations and helps move expeditiously these children and families into care. So sometimes it's not always the child that has the issue. Sometimes it's the family that has the issue. And with our programs, we can help get those families, those moms and dads, aunts, uncles, grandparents, whatever, we can get them other help they need, which is over and above just mental health and substance misuse assistance. That also follows into what we do with the child welfare programs that are primarily interested in keeping children safe, physically safe. That's what the child welfare system does. But as you know, same with the school system, parents may be going through things and struggling and they need additional help. So it's not always a punishment perspective. It's how can we get in there, keep that child safe, get this family healthy so that they can take care of their children, because then children want to be with their families and families want to be whole and united. So we try to facilitate that with the child welfare, and we have care teams that are focused on child welfare within our network throughout our 14 counties, and they work closely with the child welfare people to provide those services and get them connected with who they need to be connected with in the communities where they live.
Sure. Now, I'm glad you brought this up about child welfare being that it isn't a scolding, because I think that most of the time people initially think, I think we've watched so many different crime shows that if we think child welfare system and once they're involved, oh wow, what did you do? When the reality is, if you just break it down by the word itself, welfare, just making sure that everything is healthy and safe. And of course it would make sense that you guys would be involved there. Now, backing up just a smidge, I want to talk to Pasco and Hillsborough County school systems. I think that this is very forward thinking of them to get you all involved, because it's a lot to even take on the education system as educators to make sure that children are learning and they're progressing in that learning, versus that and taking on trying to be a mental health assessor or even helper at that stage of the game. So I think that you know, do you see that other counties maybe are kind of looking at them and going, wow, this is actually
Yes,
working?
we have presented this model to other counties. I believe there's one down south that has adopted this. One of the counties, I think it's Brevard County, I'm not quite sure about that. But there are other counties throughout the state that have looked at our model and are considering it as they move forward. There are other counties that feel like they have their grasp on what they want to do, and they had a system in place, so they don't feel the need to have an outside party come in. So, and that's all well and good if it's working for them and they're getting the help they need to those families and children. But we are available, and sometimes this kind of model takes a little while to get adopted, you know, into a system such as a school system, which is very quote unquote regimented and locked in. But we have done presentations, and I think that it will move in other counties in the future.
But at the end of the day, you're still involved regardless of whether it's after the models of Hillsborough and Pasco. You're still there. That's part of the network that you guys are a part of. Central Florida Behavioral Health Network. It takes a village. That phrase has been coined before, and you guys understand that more than anyone, and you listen, and I love that. So that's the website that you at home are looking at right there, cfbhn.org. Perhaps you're new to the area, or maybe you're in the education system and thinking, you know what, I really would love to talk to somebody about this. Who knows? You know what? It's a great website. Check it out. It's very informative at the very least. We're going to break, so it'd be a great time to go do that. cfbhn.org. We'll be back. Welcome back to Bayside. I'm your host, Shelley Sanders, talking with Miss Doris Nardelli of CFBHN. We have talked about recovery. We've talked about you're there for crisis services as well. So recovery services, crisis services, and I guess we're going backwards because now let's talk about prevention services. You do a lot in that area, many more than we'll ever have time for in this segment. But let's talk about, it's been a year since you started the 988 number, not 911, but 988. Let's talk a little bit about that. And I also want to talk to the fact that you all have a mobile response team that you can get to come out to the house when 911 isn't the answer, but you still need help. So let's talk about it. Tell me about the past year with 988. What have you seen? Has it been working? Have you had positive response from it?
Yes, it's been a marvelous thing that this 988 number was created. It is a national number. It is staffed 24/7, and it is focused on people that might be considering suicide as an option for the answer to their current situation. So you can call 988 at any time, and they will put you in connect you with a live therapist that will talk with you and work with you, and then they will connect you with a local provider organization in your area, your county, your city, wherever. So it has worked very well. It rolled out. It did very well. It has been accepted, and we have done some communication activities around the 988 and suicide prevention over the past year, and so we're very proud of that, and we will be continuing that as well.
I love that, and I do want to speak to the fact that, for example, if you at home watching are feeling anywhere close to that, by all means, call that number, 988. They're so well equipped at how to handle things and help you. And also, it's for loved ones if they've got someone and they don't know what to do, correct?
If you have a question and you suspect something, and it's not a bad thing to approach the person about it. It doesn't put the idea in their head to have them do it.
Big misconception.
That's a big misconception.
So tell me about this. Tell me about the mobile response team real quick.
Mobile response team is something we've had for several years now, and you can access that and call them at the county that you live. It's on our website. You go about halfway down our website and you'll see mobile response team.
And you're looking at the website right there. That's where you're going to find it, cfbhn.org, and go down like Doris was saying, about halfway down you'll find mobile response team. Click on it and it will tell you the number to call in your area, not for 911, 911 if you are just below that, but you still need help, but it's not worthy of a 911 call. Keep in mind, 911's for emergencies. All right, go check it out, cfbhn.org. You'll look for mobile response team. In the meantime, we're going to break. We'll be back after this. As always, I want to thank you at home for joining us this week on Bayside. And of course, Doris, thank you so much. We covered a lot of ground there.
We did today.
And there is a lot more ground to cover. You can find that on their website, cfbhn.org. That's the website. I highly encourage you to check it out. You have loved ones, you have neighbors, you have friends, and by all means, if you're a parent, you definitely should check it out. The content there is priceless. cfbhn.org. I'm Shelley Sanders. We'll see you next week on Bayside.